Patients can be assessed and treated for low T levels quickly and effectively with regular testosterone injections.
Now 62, he has more energy, has started a new business, and says the depression is gone.
A man may experience a rapid increase in energy and an improved mood.
So what is your secret? How are you doing this at nearly 70 years old?
Odds are you've seen the ads and you've seen this man, Jeffrey Life. He claims testosterone therapy, along with diet, exercise, and other supplements and treatments, is a fountain of youth of sorts. Our Movember campaign continues today with testosterone therapy. The advertising touts promises of increased muscle tone, energy, and sex drive. The ads are hard to miss, but many men wonder, is it all hype? Is it safe? What are the side effects? We have the experts here to clear it all up for us this morning. Bill Moore is here from Advanced Skin Fitness to explain what testosterone therapy is exactly. Dr. Stephen Reeder is here to discuss the benefits he believes of this therapy. And Dr. Michelle Ho has a look at some of the risks and a word of caution. So thank you all for being here this morning. And Bill, I know the ads are hard to miss. You're in a business where you tout the benefits of testosterone therapy. What are you seeing from men who are coming in? What are they looking for?
Just like I heard you announce earlier, I've had men that have come in that have gotten promotions from their jobs. They've saved their marriage. They've reduced their or eliminated their type 2 diabetes. They've increased their muscle mass. They have the ability to get up off the sofa and enjoy life again.
So that lower testosterone level in many ways has caused any number of issues or problems for them, you believe. And Dr. Reeder, you believe that as well. Are there any risks associated with this? Because when I read the literature, I see there's a word of caution about the potential for increased testosterone levels after a certain age to maybe promote prostate cancer, which of course is something we want to avoid.
There have been many studies now in the last 10 years. All of them have shown that there doesn't seem to be a link between taking testosterone therapy and prostate cancer.
And in fact, you had said to me in preparing for this bill that you believe some of the newer research may show just the opposite, that when we're younger and our testosterone levels are higher, we have a lower risk of prostate cancer, and then it would make sense that if we increase our testosterone later in life, we might also diminish the risks?
Well, there's been lots of studies that have been published, as he said, recently, and earlier studies that were taught in medical schools for 70 years were done in a study that was published in 1940, I believe. And when they went back and looked at the research, they found out that there was only one patient that had actually been reported on in that study. And now that they've looked at testosterone, we found that it is very protective. People who have been on testosterone therapy seem to have a lower risk of prostate cancer. They seem to die less from a malignancy. They seem to have a less chance of a cardiac event. There's many reasons to be on testosterone therapy.
So Dr. Ho, those who are proponents of this make it sound really good. The anecdotal evidence seems to support. I mean, you can't deny men who say they feel better, men who lose weight, who see their cholesterol levels go down. So what are the risks here? What are you most concerned about when you see advertisements like that on TV?
Well, since we don't really have evidence as far as long-term risk, we don't know, 10, 20 years from now what's going to happen, but we can look kind of in the shorter term. The more obvious side effects that some men, while they may feel great in some ways, we don't really know about prostate cancer risk. We do know that there's upwards of almost 12% risk of prostate enlargement. And then there's other side effects, just the cosmetic kinds of things, whether it's acne, some swelling. Some men can develop gynecomastia, which is breast enlargement. There's psychological things. Sometimes there's aggression that can also
So
occur.
you're not against it entirely, but at the same time, it sounds like you approach it more cautiously. If you have a male patient come to you and he wants testosterone replacement therapy and his test shows levels are low, how do you handle it?
Well, truly, I have to be honest, I usually do refer out to specialists, but there are certainly instances where it's definitely indicated. I think I would just say, again, we've already stressed this today, proceed with caution. It's not for everybody. And I think as long as you're talking with your primary care doctor and getting good feedback about you yourself, it's certainly something to talk about.
Well, it would certainly seem like practitioners like you, Bill, and Dr. Reeder are now introducing this to more men, and so perhaps over the long term we'll begin to understand more the benefits and the side effects of it. So we'll continue the conversation with this as well, and we'll put more information to Advanced Skin Fitness on our website. Dr. Michelle Ho as well. Dr. Reeder, thank you. We appreciate it. And you can go to our website, WFAA.com, for more information.